Hi, welcome to PH Insights presented by the Pulmonary Hypertension Association. Join us as we delve into patient stories, healthcare updates, and the latest insights on pulmonary hypertension. And thank you to our platform sponsors, J&J and Merck, for their unrestricted support of PH Insights. Sponsors do not endorse or participate in the development of program content.
Welcome to PH Insights. I'm Jenna Olitsky. I'm here with Allison here today talking about working with PH, something we both know just a little bit about. So why don't you introduce yourself, tell us a little bit about your diagnosis journey and what career you're in as well.
Awesome. My name's Allison. I have been diagnosed with pulmonary hypertension since 2015. When I was 17, a senior in high school, I just wasn't feeling great, but I thought that was my normal. Until one day, my biology teacher said something about heart murmurs and how people with heart murmurs have difficulty walking to their cars. I was like, maybe there's something wrong. I don't know. So I saw my pediatrician who said, you probably just need to exercise more and sleep more. But she ran some tests. Unfortunately, they came back wonky. I ended up getting a CT scan of my abdomen, which showed that my heart was enlarged. And that just sent me to the ICU the next day, essentially, where they told me I had a diagnosis of pulmonary hypertension. So immediately started on triple therapy, was noted to be the highest documented pressures at my institution at that time, but fortunately responded to medications beautifully and was able to pursue my dreams, which I found out my actual dream was to go to nursing school. And so I applied to nursing schools and ended up getting in. And ever since 2020, have been a nurse and currently am working in a pediatric cardiac ICU.
Yeah, no, that's great. And, one that you have not only the medical knowledge about now your own disease, but as well as a patient perspective, but was your PH diagnosis really what prompted you to go into nursing, or was that something that you had thought about? Because you said realizing your dream.
Yeah. Went into college being like, I'm pre-health. So I thought I was more on the pre-med route, wanting to be a physician. But as I was in the hospital, as I was out exploring the world with my diagnosis, I realized that the nurses were the ones that I actually developed the biggest connection to. So my nurse practitioners invited me to shadow them for a summer, and I said, this is what I want to do.
Yeah, no, that's great. And so going to school with a PH diagnosis, you were young and going into college and then, going into nursing school. How did you really adapt with a diagnosis of PH and trying to manage a a course load and hard courses as well?
Yeah. I would say I kind of just went into it with an open mind. I obviously didn't know anything when I first started college, just because I was newly diagnosed within that year when I first started college. And just knowing where the resources were. The PHA has so many great resources on their website, and that's kind of where I went to find different scholarships, different ideas on how to get through college and the accommodations to ask for. My PH specialists were also really great and just supported me in absolutely any way they needed to, whether it be letters, whether it be talking to my nursing school, who decided that because I had this diagnosis, I wouldn't be able to be a nurse, and just knowing where your people are and your biggest advocates.
Yeah. And so we are similar but different. I was diagnosed at the beginning of my career. You were diagnosed before your career, but really how has that shaped, going into your first career? Did you, do different accommodations? How did you approach people talking about having PH, especially for people who are wanting to either start up their career again or just getting into it?
Yeah. I had to learn how to navigate it. When I graduated nursing school, it was the beginning of the pandemic. So trying to find a job as a new nurse was the most difficult thing, especially working with COVID patients was probably not along the best things for me. So I applied to jobs all across the country and found myself in advanced lung disease and lung transplant in Pittsburgh, Pennsylvania. So all the way across the country from where I'm from. But I went into it, got an interview from actually a different PH specialist who happened to know me and just got me a connection in, which was very sweet. And with that, I kind of just was myself. I didn't share my diagnosis in my interview and just kind of kept it to who I am in general. Once I got the job, we definitely had conversations about my pulmonary hypertension and how it might affect me. I was on an infusion, and that comes with a certain week that was full of pain. And so during that week, they would try to accommodate it, being like, okay, the patients that are closer to the nurse's station, like less running around for me. I currently have a weight restriction at work, so I only take care of babies under 20 pounds so that it doesn't put me at risk for lifting up these heavy patients and doing all the things that I really shouldn't be doing.
Yeah.
So I would say in the start, just kind of be yourself and who you are. But once you get the job and get to go in there, the ADA fully supports us and giving us the accommodations we need to be successful.
Yeah. I think it's really true of, especially in the work environment, people don't need to know everything, but there's certain people who do need to know, and they're really, you might be scared at first to tell them about this because you want to perform well, you want to do your job, but they're really there to be a resource more than anything and be able to help you on days where you may not feel as well or you need more accommodation, whatever that might look like for you. Um, so what have been, besides what you had just talked about, what do you do on days where you may not be feeling well or just, you know, day to day stuff for us where it changes? It's unpredictable sometimes with careers.
Yeah. I would definitely say I'm of the mindset of like just like grin it and bear it and just get through it. Which can be a downfall at times. Obviously, like we push our bodies too far and we learn from it.
Yeah.
So I would say like don't be afraid to use your sit time. I probably have the most hours on the unit because I never call out. And other people are calling out for multiple days per schedule. And I'm like, well, I just, like, feel so bad because I know I can do it. So it's just that balance of being like, "Okay, I am going to be a patient safety issue if I come here this day." Like, it's really about the patients and not about myself.
Yeah. I think that it's kind of knowing your limitation because PH patients, I can speak from example. I can speak hopefully for you too, where you say, we are pretty resilient and, we do very well when we are doing well. And so we don't want to, say that we're not doing great and we don't want to use that as an excuse because we also know what it's like to do even worse sometimes. So I think it's one of those of knowing when you have to have that limitation, especially in a job where you are caring for patients or for me in law where you're like, I have to be the best for other people too. So you have that type of mindset. And if you were to give advice to someone who is, you know, like your younger self, where they're going through trying to decide career, they know they have PH, what would be something that you would tell them?
I think the biggest thing is your diagnosis doesn't define you. When I was first diagnosed, everyone tried to put these limitations on me. It's like, "You can't be a nurse. You should just do something else." And really just being like, your body will tell you what you can do, and you're not gonna know until you actually try it. So feel free to try those things. Your body might tell you no, and you'll learn from it, but really, you can't knock it until you try it.
And I think also taking away from your story that you could still pursue your dreams, pursue your dream career, but there may be, different things like you're now working with babies, because of the weight restrictions. You could still achieve your dreams. So it just may look a tiny bit different too.
For sure.
Well, thank you so much for joining us. I hope that you all learned a little bit about working with PH. And thank you so much for your time, Allison.
Yeah, absolutely.
And thank you for listening to PH Insights presented by the Pulmonary Hypertension Association. Remember to subscribe and to join us every second and fourth Wednesday of the month for more valuable insights.